Yes. All right. Welcome, everybody. My name is Anna Locke. I am a registered dietitian, diabetes educator, nutrigenomics educator from Louisville, Kentucky. And we have an amazing group gathered today to do a video presentation on some information that I think will be important to a lot of people. And we're going to talk specifically about oxidative stress and issues specifically related to the equine world. And so all of these people that are on this Zoom with us today are people that have a passion for taking care of horses. And so we have Dr. Lee Seward with us. Dr. Seward is a veterinarian. He is a doctor of veterinary medicine. After a time in clinical practice, he spent the majority of his career in research. He was responsible for the development of a number of successful products, including HeartGuard for dogs. He is an expert on aging, age-related diseases, and nutrigenomics. He is frequently called upon to speak to interested groups on these subjects. Thank you, Lee, for being on the Zoom today. And so I think we'll just introduce everybody one at a time as we speak. So I asked Lee to be on this Zoom today to share about his background in the research world and specifically what he can share with us about this issue of oxidative stress in animals, and especially the nutrigenomics aspect of what all of us on this Zoom have in common. So Lee, I'm going to turn it over to you.
Thanks, Anna. It's a pleasure to be with you. And, you know, we've known each other since we got involved with this whole business of nutrigenomics and the products that are related to it. And it's one of the great benefits of what we do is to be able to work with such wonderful people that have such a passion for helping animals. And it's a pleasure to be with the rest of you. I've known the Heaths for a number of years like you, and you guys are among my favorite people. And today I have the pleasure of meeting some new people in the group here. So it's just a joy to be with you. And it's a beautiful day out here in Colorado. So anyway, nutrigenomics. Well, of course, as most of you realize, nutrigenomics is the ability to affect gene expression through nutrition, through diet, and through supplements. And that means trying to affect our gene expression, our personal abilities through diet and supplements for our benefit. And it's just a mushrooming field. It's become an area of tremendous interest in the last few years. And we're finding more and more that there's a lot of ways that we can affect gene expression to our benefit, and lots of ways that we can affect gene expression to our detriment. And what's great about this is these apply equally to animals as to humans. So in horses, which we're talking about today, we know through the scientific literature that horses have the same basic aspects of gene expression that can be affected by their surroundings, their diet, and certain nutritional supplements. Oxidative stress in horses. You know, oxidative stress basically is an oxidative process at the cellular level that generates toxic molecules inside our cells. And those molecules are charged molecules and essentially tear apart the machinery of our cells and affect our gene expression in a detrimental way. And this is something that happens in humans and animals. Very similar mechanism is what they say conserved across the entire mammalian line. So just about all animals are affected by this. And it is a process that is exacerbated generally as we age, gets worse and worse. And it's involved in our nutrition. We generate oxidative stress and when we eat, we generate it in our environment, exposure to toxins, light, etc. So it's a fact of life. It's a fact of living for us and animals. And oxidative stress is associated with just about any of the chronic diseases that you could think of in humans and in animals. And that's well documented in the scientific literature. If we look at when I first got exposed to this whole area was actually on an airplane where somebody pulled out a video. It was a video that was broadcast on network television years ago about a professor at the University of Colorado that had come up with a new product to battle oxidative stress. That particular product was investigated by ABC News. And I saw that video on this airplane and it intrigued me. So I got to looking into oxidative stress, which I was familiar with, but I was familiar with it, what we called free radical damage. The bottom line is what I found in looking into it and doing my due diligence to see what this was all about was this was a hot button in medical science and in science at that time. There were something like 90,000 papers on oxidative stress in the National Institute of Health Library, PubMed.gov, an online library of all peer-reviewed science and medicine in those in the fields. And oxidative stress had 90,000 papers. So obviously, big deal. Well, let me tell you something. Today, there are over 300,000 papers, over 200,000 papers on oxidative stress on PubMed. And many of those papers are directly relevant to animals. They're studies done in models and cell culture, etc., that even though they may be aimed at human medicine, they have the same application because the same mechanisms are present in animals as in humans. So let's look at horses specifically and look at oxidative stress in horses. Well, even in PubMed.gov, which is like I said, the National Institute of Health library, obviously aimed at human medicine, there are over 300 papers on horses and oxidative stress as it relates to horses and horse conditions and horse diseases. If you use other search engines, again on PubMed, there's another search engine in that library, National Institute of Health Library, called PMC, PubMed Central, and there are over 1,800 papers relating oxidative stress and to horses. And if you go to another search engine that is one of my favorites, that is a lot broader, called scholar.google.com or Google Scholar, there are over 40,000 papers that cover oxidative stress in horses. So obviously oxidative stress is a big deal in horses. And oxidative stress relates to hundreds of diseases in humans as well as animals as a cause or as a modifying factor in these diseases. So oxidative stress is part of a whole nature of the animal. In other words, like I said, it's part of living. But we all know horses. Horses are athletes. Even the horses that people don't call athletes, that they think of there as being pets. You got to remember, the horses are, by their nature and by their ancient origins, prey animals. That is, they are food for others. So they are designed to flee. And as that ability to flee means they are athletes. And through that whole nature of the beast, they generate a great deal of oxidative stress. All their metabolism is geared to be able to move quickly, and that generates oxidative stress. I like to say to people that horses are, and most people that know horses agree with me, that horses are inflammatory machines. they generate a lot of inflammation whenever they are confronted with any sort of disease or injury. And that's a whole part of this oxidative stress thing. Inflammation, fibrosis, oxidative stress are all part of the same pathways and progression of processes at the cellular level. And we know this in horses. So I don't want to get too far afield because we are limited on time, but I just want to make sure that everybody understands that this is not something that is debatable. This is established science. Thousands of papers, thousands of studies, just about on any subject you want to think about and how it relates to oxidative stress. Here's one that I know you'll learn a little bit more about here in a few minutes. But I just happened to spend a few minutes this morning just pulling up some papers because there's so many of them that it's not debatable. But here's one I thought you might find interesting. I don't know, is this backwards or forwards? Okay, so it's oxidative stress and hoof laminar tissue of horses with lethal gastrointestinal disease. Well, basically what it's talking about here is our dreaded disease, laminitis, in horses as a result of a lethal gastrointestinal disease. So oxidative stress is part of laminitis, one of the main and dramatic diseases in horses, and the Heaths are going to talk a little bit more about their experience in that. Here's another one here that talks a little bit about oxidative stress in endurance racehorses. That oxidative stress is generated by significant athletic activity. Here's another one that talks about physical exercise and oxidative stress and muscle damage in racehorses. Again, oxidative stress. So what I'm just trying to point out to you that in those search engines that I just mentioned, there are hundreds, if not thousands, of papers that relate oxidative stress to conditions that we're trying to combat. So the issue here is that anything that we can do to lower oxidative stress through nutrigenomics, that is through diet, or in this case, a supplement, an NRF2 activator that has been proven in humans to lower oxidative stress by 40% in 30 days. And in other animals, we know it has a very similar effect. It's been documented in a number of studies to have the same effect in other animals and from our own experience. So we know that we can, in fact, impact oxidative stress through the NRF2 pathway. NRF2 is a protein, cellular level, that once it's activated, affects the expressions of the genes, and again, nutrigenomics to reduce oxidative stress. I'd like to mention another aspect of animals and nutrigenomics, and that is NRF1. NRF1, totally unrelated to NRF2, sorry about that, folks, is a little bit more complicated. But let me this is leading edge stuff. The company that came up with the NRF2 activator is at the forefront of nutrigenomics, working on things that no one else has touched. The first NRF2 activator, and now the first NRF1 activator. Now the NRF1 we're talking about here is actually called the nuclear respiratory factor, and it's a totally different pathway than the NRF2. So you have to be careful when you look at the scientific literature. But just let me tell you that we know from our own research that is in progress that our NRF1 activator does in fact impact mitochondria. That is, it reduces mitochondrial dysfunction and improves mitochondrial production. Now, why is that important? Because mitochondria are at the heart of energy production in animals. That is, they produce the ATP that is the energy currency at the cellular level throughout the animal. So here we're talking about athletic animals, horses, that have a great need for rapid energy production and rapid energy use. And mitochondria are, in fact, at the root of all this. We know from the research that is in progress that our NRF1 activator improves and increases ATP production and also increases mitochondrial mass. These studies are underway. We don't have the complete results yet. So, nutrigenomics, can we improve the life of animals? You bet we can. And there are products out there that do this. I just, a couple of things about this in my own experience is that in our own horses, we've been using some of this, these products for a number of years, particularly the NRF2 activator. And just give you a couple of quick observations. We have one mare that we have actually was born on our place. She went to another home for a number of years. She was a family horse, and then was a brood mare for a number of years. And then we brought her back home here. And after being in those surroundings for all those years, we noticed a completely different animal, different behaviors, particularly very anxious, very flighty, difficult to be around on the ground animal. She wasn't mean, she wasn't trying to hurt anybody. She was just an anxious, active animal that you just had to be careful when you were around her. We had her on the NRF2 activator for a while. We started to notice something that she started getting more or less active, a little more calm, a little more relaxed, and not so feed worried, etc. Where we weren't so, initially when she first came back, I was concerned about people being around her on the ground. We didn't let visitors and stuff go in the pen with her because, again, not because she was mean, she was just moving all the time and anxious about things. So now, after a few years of being on the NRF2 activator, dramatically different animal, a different attitude, very much easier to be on around. She also has some problems with, we don't even know the cause of itching, skin itching, etc. And we've seen her every summer, early in the summer, when she's out on our front pasture, start getting rubbing on things to where she'll even excoriate the areas. So we have to pull her off that pasture. We have to bring her into the paddock. We've tried everything, including desensitizations, all kinds of things. We upped the dose of the NRF2 activator this year and completely removed the itching. No itching the entire summer. Dramatic demonstration of nutrigenomics. And I think with time and interest, I think I'll hold off there and let you go on to new subjects.
Thank you.
Thank you very much. Enjoyed it.
Thanks. That was great. And we'll be bringing you back here in just a minute with Elizabeth's questions. But I think you created a great segue into letting Bonnie and Kim Heath share next. And Kim, I'm going to unmute you, and Bonnie, you can unmute your line. And so Bonnie and Kim Heath are dear friends of ours that we met through, again, our connection with this technology and the company that it's connected with. And Bonnie and Kim are owners of a horse farm in Florida. And Bonnie, I'm just going to turn it over to you, and Kim, if she wants to chime in. I want you to just share a little of your background, but really the power of what you've seen in this technology of nutrigenomics in your horses.
Very good. Thank you, Anna. And Lee, it was great hearing you, as always. My family's been raising thoroughbreds for over 60 years in Ocala. And when I was 6 years old, my father and his partner had a horse that won the Kentucky Derby. And I thought, this is pretty easy. There's not much to this. But I basically tell people I was diseased at birth, and I had no choice. My sisters didn't care about it, but I quite love it. And I've done various and sundry other things, everything from selling women's dresses wholesale to being a stockbroker. So my passion is the horse. And Kim and I were introduced to NRF2 technology in late April of 2013. Well, initially August of 2012, and paid no attention to it for 8 months. And then 8 months later, late April of 2013, we were introduced again with the same video that Lee mentioned. And it made perfect sense to both of us for ourselves. And we take pretty good care of ourselves, or we did at that time. And but it made perfect sense for us. It made perfect sense for our horses. And little did we know what was coming down the pipe, because 3 weeks to the day later, our best thoroughbred mare, Miss Pangea, who was 18 years of age at the time, we had raised her from a foal, and she had a stillborn foal on a Friday, and she had some retained placenta. And the next morning, it was actually Preakness morning, 2013, she's got full-blown laminitis. And for those of you that are in the business, you understand how awful that disease is. And those of you that don't know what it is, I hope you never find out. But just take my word for it, it's the most devastating disease that an equine can have. And she's got the death look in her eyes on that Saturday morning. I'll never forget it. The vet came promptly, and he treated her with standard Western medicine, which I'm sorry is not all that effective. And God bless Kim. She had been smart enough before this, several days before this, to give our vet information about NRF2 technology and the pathways, et cetera. And he had actually had read it and understood it. And so after he treated our mare, she shoved a bottle of this product into his hands and said, "What about this?" And he said, "Why not?" And we said, "How much?" He says, "I don't know." He said, "Well, I want to tell you this." He said, "You give this all to her right now, this whole bottle to her right now." He said, "You will cause no harm." And that's refreshing. Those of us that have had drugs around our animals and around ourselves understand the caution that you use sometimes. And a nice feeling to know. Well, anyway, we administered this product to her, and I said, "I'm 175, 180 pounds, and I take one of these a day." So we gave her 9 because she's 1,150, 60 pounds, whatever she is. And we spaced it out over the day on Saturday, and we did the same on Sunday. By Sunday afternoon, this 36 hours roughly into this, her eyes are clear. She's looking out the top of her stall, and she's nickering out in the paddock to her buddies, and she's stepping out of her ice tubs. We had her standing in ice about 14 hours a day, ice and water. And she was that much better, that dramatically much better in that short a time. And it was unbelievable. It really was. So the vet came back every day, but on Tuesday, which was day 3, he shot x-rays, shot pictures of her feet. And he calls us up in a couple, 3 hours, and he said, "Want to let you know," he said, "there's no rotation of the coffin bone, and there's no sinking of the sole." And I said, "You have got to be kidding me." He said, "No, not at all." And he said, "In fact," he said, "I've got to give you some more antibiotics." He said, "I only gave you enough for 3 days initially because I didn't think she'd live 3 days." I said, "Well, Bill, I didn't think she'd make the first night." So anyway, he did that. 3 more days go past. He pulls another blood, and he calls us up in short order, and he said, "I've got another vet that's close by. He's going to come pull the catheter out of her neck." He said her blood work is perfect. And I couldn't believe what I was seeing. So in very short order, within about 3 weeks, she was out in a round pen. She never had a shoe on during this whole ordeal. The next spring, when she was 19 years old, she was in such good health that we bred her, and she got in foal on 1 cover. And of the 4 years she's been eligible to have a foal since that time, she's got 3 babies. So she's 23 years old, and she looks as if she's maybe 12. Had a good video of her on Facebook last week, I guess it was, running across the paddock with her baby by her side, and she's just a joy. So that was our experience. And Lee talked about the oxidative stress and these being inflammatory machines, and horses and dogs tend to show dramatic change quicker than humans. I think for two reasons, because they oxidize faster than we do, and they're not burdened with this 6 inches in between here that we all are. So I think that's the deal. We use it for non-sweaters. Had good success with non-sweaters down here in Florida. We use it for old arthritic horses. We had an old mare that was 29 and extended her 2 years of life, and it was very, very pleasant to see her turn around from being able to barely move to being able to gallop across the paddock. And we use it for sales yearlings and sales weanlings that go to sales up in Kentucky. And it gives them tremendous focus and tremendous endurance from what we've seen before. So it's something like I've never seen before. It really is. And so that's my story. Kim, what you got? You got anything to add?
Well, maybe a little bit. Just that I don't want people to think that when you have a crisis like we had, that you automatically give them 9 pills.
Right.
We did that because we didn't know, and there weren't any specific horse recommendations when we started this. But now we know that that was probably overkill. I'm not inclined to start a horse that's in a crisis with just 1 or 2 pills a day. I would rather go up higher than that, just because you're going to get a faster process. But I don't think that anybody should feel like they have to give a horse 9 pills a day. So we know a little bit more because of our experience over the years. So, but other than that, I'm ready for questions if everybody else is.
Great. Great.
Kim, can you tell them about the NRF1 real quick?
Mm-hmm.
About the old mare?
Yes. We had a mare that had heaves, which is essentially a human or a horse version of a human COPD type situation. And she was in really bad shape, struggling to breathe. And we put her on the NRF2 activator, and she was significantly improved. And then along came the new NRF1, and we added that to her program, and she was another dramatically improved situation. So she went to maybe half the way back to health with the NRF2, and another half, so she was 3/4 of the way back to health with the 2 products. And I believe that we eventually had her in a situation where she was not blowing hard when she breathed. Over time and years, she ended up passing away from complications of the medications that she was taking before we started the NRF2 and NRF1. She was on massive doses of steroids of various different kinds, and they take a long-term toll on the animal or in the human too. And I'm sure Lee can tell us a little bit more about how that works. But that's our experience with the mare with the heaves.
Thank you both. Wow. So if it's all right, then I think what I'd like to do next is bring Elizabeth Van Ross on. And Elizabeth is actually joining us from France. And you may notice that her accent is not French, because she is originates from the UK. And Elizabeth has a tremendous passion for horses. So I think it would be nice just to share briefly your background, Elizabeth, and then you had some questions specifically for Dr. Seward and for the heats. So you're on.
Great. Well, thank you for having me on, and it's very interesting to meet Lee and to re-see Bonnie and Kim. That's brilliant. So hi everyone. yeah, briefly for me, I mean, horses have been my life. I've worked with horses my entire life, doing various and wonderful things, competition, but to start with, but then moved quickly into rehabilitation of horses. I now am what's called an equine locomotion therapist, but I work a lot with the human equine conundrum. So humans not necessarily always understanding what a horse is as far as how it actually functions mentally and physically, which leads to quite a lot of conflict behavior, and also breakdown of the mechanisms, the biological mechanisms of both the horse and the rider. I work on the riders as well. So really, being introduced to the NRF2 and all of this is brand new to me and sounds miraculous. I did work 7 years for the largest independent equine hospital in the UK. That is got a worldwide reputation, and was their leading rehab specialist, and worked with an amazing team of vets and farriers and physiotherapists and dentists and and obviously different medical vets, as well as vets dealing with all sorts of lameness issues. So my real interest on this call tonight is that I've obviously started to talk to a lot of people about this product. And there's a doctor friend of mine who's also been a long-term client, who has a horse who has had chronic pain. I mean, she's a horse that started off her career like a lot of dressage horses do. She's a high-level dressage horse. She was trained in draw reins. She was overtrained as a young horse, and it's all caught up with her now. And for the last 5 years, she's had real issues that none of the vets, local vets that were dealing with her in the Lyon portion of France, could actually come up with any answers. So she was recently brought to my area to a guy called Jean-Marie Denoy, who is very well known for his work with trotters in France. And he's should be well known. He's well known in the States. I don't know if you've ever heard of him, Lee. But he has an amazing clinic here called La Cyrale, where they have unbelievable technology that can look at these animals. And they found that she had an ancient C7 fracture that has healed, but not very well. She has arthritic changes in the right side of her pelvis, in her hocks, in her stifle, and she also has very bad respiratory issues. They don't really know what's wrong with her lungs, but there are parts of her lungs that are quiet. So this poor horse is literally on her last legs, and if we can't come up with a solution for her, the only next step is euthanasia. And she's only 13 years old. She's not old. She's a fantastic horse. She's given literally every ounce of energy she possibly can. And her, as I said, her owner is a medical doctor, human medical doctor herself, and is sort of grasping at straws. So this is kind of the last thing for this particular horse. So my question was, how does NRF2 load up into the body? I mean, we've talked a lot about dosing. How much do we give a horse? We've talked about obviously Bonnie and Kim's experience with a horse that was in acute failure, whereas this is sort of chronic and long-term exposure. And this horse has had every medication you can possibly imagine, Ventipulmin, all sorts of steroids. She's been injected with hyaluronic acid, as well as the more traditional, Lee, you should be knowing the word better than me, but I've lost it right now. But anyway, one of the other anti-inflammatory agents that are used. And my question is, where do we begin? If we're going to use this to rebalance her, and even if it's nothing more than to give her some relief, where do we begin? What's my first step? How do I advise this particular person with her horse?
Oh, yeah, that's an interesting case, interesting problem, because it covers so many different aspects of oxidative stress. Virtually everything you talked about there has some relationship to oxidative stress, inflammation, or fibrosis. Three things that are named in the patent for our NRF2 activator. It's actually a patented product covered by, I think, at least 7 or 8 patents in the United States and 11 patents worldwide, and maybe more today. So while we cannot make any claims to treat any disease condition or mitigate any disease condition, or cure any disease or condition, or diagnose using our technology, we do know that it reduces oxidative stress, inflammation, and fibrosis. So to get back to your issues and questions. So the first thing is that this is not a loading dose. This is not a product where it has a loading dose or a long-term effect. It is a pulsatile type system. So once you give the NRF2 activator and it enters the system, and does the cascading at the cellular level to activate NRF2 and affect gene expression, that is a relatively short period of activity that is actually doing that. The benefit, the reduction of oxidative stress, is where the cumulative effect takes place. So each time the dose is administered on a daily basis, you affect oxidative stress, you affect the gene expression, you increase the enzymes that reduce the oxidative stress at the cellular level. That whole cascade is, if you do it every day, you start accumulating the benefit of reducing oxidative stress. Hence the studies in humans saying we reduce oxidative stress within 30 days, because we know it takes place over time. What's interesting about that, studies in humans also show that you reduce it even more as you continue to give it. And it's the same in animals. And that's why we notice in animals as well as humans that the benefits frequently take time, because you're dosing, you're getting this gradual improvement, dramatic, but gradual improvement in the level of oxidative stress, reducing that oxidative stress. And then you have the body repairing and balancing based on this reduced level of oxidative stress that it now has. So the benefits that you might see in a specific condition due to the reduction of oxidative stress take place over time as that oxidative stress gets to a level where the body is benefiting and allowed to repair itself. So the repairs start benefiting the animal and the disease process that you may be experiencing because you've got this cumulative improvement in the level of oxidative stress. Now, the other questions you ask as far as dosage goes, people, sometimes we have this idea about the precision of dosing. But let me ask you this: when people take, let's say a Aleve or aspirin, does everybody get the same benefit at the same dose? I think not. No. I don't think they do. I think even on an individual basis, we individually experience a different benefit from things we do, the things we eat. We respond differently. So let's take that a little level further and go to different species and say, wow, if you give a certain thing to a certain species, are they going to react the same as another species? And the answer is no. One of the examples, and it may be the product you were talking about, it's a anti-inflammatory that you may have been speaking about being used in the horse. It's called Oxidative. It's a very, very potent anti-inflammatory and extremely potent and beneficial in horses. But let's look at the difference in dose, say, of that particular product, because there is a product in dogs as well as horses. The dose in dogs is many, many, many times higher than the dose in horses. I mean, a 100-pound dog will take a tablet. A 1,000-pound horse will take a quarter of a tablet. And this has to do with all kinds of variables. But one of the things that a lot of people don't appreciate, not only the difference in the metabolism, how they absorb things. Obviously, the GI tract of a horse is not the same as a human, not the same as a dog. So they're going to absorb things differently. They're going to process things. Their liver functions slightly differently than a human liver. So they're going to process things a little differently. So you've got all these variables, plus the fact that what we call volume of distribution. The creator of this NRF2 technology estimated initially, when somebody asked him, before we even knew anything, that horses are likely to take far less than humans of this particular product to get the benefits, because their volume of distribution is so much different. That is, they have a lot more bony parts of their body, a lot of their structure is what I call inert structure, the tendons, the ligaments. So a lot of the weight involved in the horse involves things that aren't really dynamic and in their exchange of fluids, etc. So they're not really absorbing and metabolizing drugs or nutritional products such as this NRF2 activator. So you're going to have a different dose. So what you have to do is you either have to study it and determine dose, or you have to use what I call empirical dosing. You have to look at a dose, start at something that sounds reasonable, and look at the effect. And that's something that Bonnie and Kim experienced when they were working with Miss Pangea, and something that I experienced working with our horse, and what other people have experienced. So what we've found, that boil it all down, is if you're looking at just the well-being of an animal and wanting to reduce the oxidative stress for their well-being and overall health, which you're going to get by reducing oxidative stress, then it's not uncommon for people to feel that 1 to 2 tablets of this NRF2 activator are beneficial. Now, if you're trying to have a specific benefit, you may want to go higher than that for a while to see if you can impact that specific issue that you're trying to benefit. So I know that may not be precise enough for a lot of people, but I think that's the guidelines that we work with. I've got right now, in my 2 horses, I've got 1 horse that gets 1 a day. I've got 1 horse that gets 3 a day.
Mm-hmm.
So, and that's just because in the experience of working with these animals, those are the doses that, from our observations, seem to be reasonable and beneficial.
And that's a long-term dosage. I mean, they've got.
Yeah, I mean, I think I might be able to drop back to 2 on the 1 horse instead of the 3, but we're so excited about what we see in her. This is the horse that we're just making her feel better, and so she's acting better. So we're affecting her attitude towards us and our joy in being around her. So I'm willing to give it the extra pill a day to make sure that I'm achieving that.
Yeah, absolutely. Also, can I ask you, the NRF2 is naturally occurring within the body, and from what I understand, for humans up until the age of 20, the oxidization and the antioxidants are kind of balanced naturally within the body. Why does it slow down at 20? And I'm not sure at what age in a horse, but what makes that process slow down, and then the antioxidants kind of, I mean, the free radicals get more of a hold on the body?
Yeah, well, that's a great question. The reason I consider myself an anti-aging expert is, hey, look at me. I'm against aging. Obviously, it hasn't. But anyway, basically, it is a fact of nature of the animal that these systems essentially, by design, work well as the younger we are. I don't think 20, you can say 20, essentially oxidative stress starts at birth or even before that, and it's a constant progression. And the systems do well up until about 20 or so, balancing this out. But then we start being subject to our exposures. See, as we age, we're subject to more exposure. At 20, you've been exposed to things for 20 years. At 40, you've been exposed to those things for 40 years. When you get to be my age, you've been exposed to those things forever. So what we're talking about here is our metabolism generates the oxidative stress, our exposure to toxins, environmental toxins, all the things that we induce in our world, that we expose ourselves to, but even the natural things like solar radiation, etc. All those things are part of generating the oxidative stress. So it's just a matter of being exposed to those things longer is why they get ahead of you. There is also some decrease in the efficiency of these things over time. That's just part of wear and tear on our systems. So you have increased exposure, our inability to keep up with that increased exposure, and the decline in the efficiency of these systems. And what we found, of course, is that through nutrigenomics, we can impact that. We can increase our ability to deal with that decline in our effectiveness in expressing NERV2 and impacting these survival genes that are so beneficial in combating oxidative stress, inflammation, and fibrosis.
Okay. And then going back to this particular horse, she's on obviously quite a bit of medication. Would it be all right for her to start on the NRF1 and probably, I mean, the NRF2, and I'd imagine she might benefit from the NRF1 as well, whilst still taking her medications? Is there any contraindication?
Generally speaking, no. The ingredients, the natural ingredients that are in the NRF2 product have been around for hundreds, if not thousands of years, used in traditional medicine, particularly throughout Asia. So they've been used not just in humans, but in animals. There's records in the historical records of being used in animals for hundreds of years. Here in the United States, the product has been available for considerable periods of time. Literally hundreds of thousands of humans have been exposed to these products, and certainly thousands and thousands and probably hundreds of thousands of animals have been exposed to them too. So in that exposure, we know that many of those animals have had all kinds of other products and pharmaceuticals that they've been exposed to at the same time, and there's been nothing identified to be a concern. There are some specific issues that really don't impact this discussion, where you might want to be a little bit concerned, having to do with particularly with organ transplants and chemotherapeutic treatment of certain cancers. There's, again, in your case, that's not something to be concerned about. But for the most part, we know of no really serious interactions that I've been aware of.
I'll add something to
Anna, did you have something?
Yes, yes. One of the things that I like to point out when that question comes up is something I've heard from other medical professionals in our connection with this, is that even when people look at the ingredients and they might look up, for instance, turmeric and see, oh, turmeric has an interaction with such and such. But what we have to really remember is the amount of the ingredients that are in these products. These are minute amounts of the actual herbal extract. So it's not like the large dosing of those herbs that are typically given for a particular therapeutic issue that, you know, people just using the single herbs tend to do. So it's you have to really take that into consideration. Would you agree, Lee?
Excellent point, Anna. That many times these herbal ingredients that might have specific uses in herbal medicine, the dose in those uses is hundreds of times greater than the amount that's in this product. And the reason that's so is because what the creator of this technology did is find the ingredients and the levels that, when put together, caused an immense increase in the effects. That is 1,800-fold increase in the expected reduction in activation of NRF2 and reduction in oxidative stress over what you would expect by the individual ingredients. So it's a massive magnification of the benefit of this particular nutrigenomic product by having these mixture of ingredients to have this patented synergy.
Wonderful.
One other comment quickly, Anna, about this whole issue of interactions is that even with pharmaceuticals, they don't test all the possible interactions. They're not tested before the products are released into the marketplace. They use, many times, they do test against specific things that they know that the products will be used with, but they don't test every possible combination that's out there. They rely again on the exposure and field trials, where they're hoping that they can experience as many other products as possible. But again, it's really after the products go into the marketplace that they find out where there might be interactions.
Right. Thank you. Elizabeth, is that does that take care of questions or anything else?
No, I think that's pretty much it. I think especially that we're pretty much running out of time by the looks of it. So no, that really answers quite a few of my questions, and certainly will put to rest some of the questions that the owner had with this specific horse. So I'll be looking forward to give you guys the results and you know, follow her along.
Awesome. Okay, Monique had a question, so I'm gonna just let Monique ask her question.
Right, I have a couple of questions. How long before you can see how long do you wait to see a reasonable improvement when you adjust the dosage? And then the other question, so you can answer them together, since it is pulsatary and when you give 2 or 3 tablets a day, is it better to give them all at once or divided?
I'm going to let our horse people answer that. And Lee, if you have any input.
Yeah, the question about the pulsatile effect, if you're in a situation that you can do it, let's say you're giving a horse 2 a day. You can give them 1 in the morning, 1 in the afternoon, space them out 7 or 8 hours, great. Not everybody's in that situation where they can do that. As Dr. Fifi would say, just get the pill in them somehow, you know, either way. So what was the other question? What was the first question?
How long do you wait to see an improvement before you ask for a
Yes,
regular?
very good. Obviously, you know your horse. That's kind of what Lee was saying about his horse. You know your horse, and you don't have to worry about overdosing, which is wonderful. So, like I say, when Miss Pangea had her crisis, we didn't know. I mean, we're brand new. Nowadays, we would start a horse in that situation probably with 4 or 6 a day, spaced out twice, 3 in the morning, 3 at night, and then start scaling back after a few days. But when you know your horse and you know what they normally do and how they normally act, then you can just base it off of that. And I wouldn't wait a whole lot. I'd wait 3 or 4 days, maybe a week at the most. We had a mare similar to what Lee was talking about, his mare that he got back. We took a mare from rescue and who had been starved. And boy, I'll tell you what, feeding time was a rodeo, and you would get hurt. And I don't think she meant to be mean, but she was going to eat her, or hurt you in the process. Today, no, we cut her a wide berth just out of respect, but she's not that same. She's not that same individual that we got. So, but know your horse. That's the end of the deal.
Is that good?
Yeah, that is good. These were questions specifically for a friend. She has her horse has heaves and is laminitic, and has tendencies for what do you call that? Metabolic syndrome, Cushing's. Yeah. So it's all. I assume that is all has to do with the oxidative stress.
Yep.
So.
Absolutely. Yes.
Major component, you bet.
Yeah.
And I think also getting back to what Bonnie was saying is that, we see the responses a lot more rapidly in animals, dogs and horses, and but it depends on the condition too. So something that's a chronic condition, many times, you may have to get a little longer.
Freezing, honestly.
A week or two, wait and start but down, sort of thing. So there's all kinds of ways to approach this. It is empirical. I've seen things in one of my dogs where it took quite a while because it was a very chronic, debilitating metabolic disease that had dramatic effects on the dog clinically, on muscle mass, on hair coat, etc. So to see the results on hair coat, see the results on muscle mass, it's going to take time for those things to improve.
Great. All right. Well, what a wonderful group and wonderful sharing of information today. I am so grateful to everybody that was able to be on this today. And I just want to close it out to say, this will be shared with others. So we invite whoever, however you got exposed to this video, to get back with the person who shared the information with you, because they obviously believe that this could be helpful information for you, and they can help you in terms of looking at product information if that's something of interest that you want to pursue after you see this. So thank you to everybody. I'm so grateful, and we're going to close it out. So thanks to all.